Hey everyone, welcome back to FNP University, your premier source for medical education. We're continuing our Pharmacology Made Easy series, and today we're going to tackle a crucial topic, anticoagulants. If you find this video helpful, don't forget to like, share, and subscribe. Let's get started. Anticoagulants, or blood thinners, are a group of drugs that prevent blood clots. They're used in a variety of conditions, from preventing stroke in patients with atrial fibrillation to treating deep vein thrombosis. But with so many different anticoagulants out there, how do we choose the right one? First, let's talk about the different types of anticoagulants. We have the traditional ones, like warfarin, and then we have the newer direct oral anticoagulants, or DOAC, like dabigatran, rivaroxaban, and apixaban. Each of these drugs works in a slightly different way to prevent blood clots. Warfarin, for example, works by inhibiting the synthesis of vitamin K-dependent clotting factors. It's a powerful anticoagulant, but it requires regular monitoring of the INR, a blood test that measures how long it takes for your blood to clot. On the other hand, DOAC work by directly inhibiting either factor SA or thrombin, two key players in the clotting cascade. They don't require regular monitoring like warfarin, but they can be more expensive. They have several advantages over warfarin. For one, they have fewer interactions with food and other drugs, which makes managing treatment easier. They also have a predictable effect, so they don't require regular monitoring like warfarin. However, they can be more expensive and place more financial burden on the patient. And unlike warfarin, their effect can't be easily reversed in case of bleeding. Choosing the right anticoagulant depends on a variety of factors, including the patient's specific condition, their risk of bleeding, their other medications, and their lifestyle. Let's take a case example. Mr. Johnson is a 70-year-old man with atrial fibrillation who is presenting for treatment of his chronic paroxysmal atrial fibrillation. He has a past medical history of stroke, hyperlipidemia, and chronic kidney disease, stage 3. Looking at confounders like his medical history, with a special emphasis on history of stroke, he's at an elevated risk for stroke, so he needs an anticoagulant. However, he has trouble getting to the clinic for regular blood tests. In this case, a DOAC might be a better choice than warfarin. Another reason this may be a good fit for Mr. Johnson is they are associated with less bleeding events. But before we make a decision, we should also consider his bleeding risk. We can use the HAES blood score, which takes into account factors like hypertension, abnormal liver or kidney function, stroke history, bleeding history or predisposition, label inner, elderly age, and drugs or alcohol use. Mr. Johnson's has blood score is 3, which indicates a moderate risk of bleeding. This score is another factor to consider when choosing an anticoagulant. As you can tell, there are many steps you must consider before going to the script pad. Remember, the key to mastering pharmacology is understanding, not memorization. Try to understand how each drug works, its side effects, and its interactions with other drugs. Even certain foods like leafy greens can interact with warfarin, increasing bleeding risks with increased consumption. These considerations will not only help you pass your exams, but also make you a better healthcare provider. We would love to hear your experiences with prescribing anticoagulants. What strategies have you found helpful? Share your tips and tricks in the comments below. Anticoagulants are a crucial part of many treatment plans, and understanding them is key to providing the best care for our patients. For more in-depth discussions and guides, visit our website at wfenpuniversity.com. Don't forget to like, share, and subscribe for more videos like this one. As always, be well and stay healthy. And see you in the next video.